my name is Ella, and these are my group mates Teresa, Michaela, Helen, and Rakaya. In this presentation, we will be discussing about a current health concern that we found from global news, which is about polio. Polio virus is a highly contagious viral infection that can cause paralysis and death. It is important for nurses and healthcare workers to know about polio as they play a key role in the prevention, early detection, and education about polio. They need to be able to understand the disease so that they can recognize symptoms. They also need to educate patients about the importance of hygiene and vaccinations to prevent and protect others.
Okay, so this slide is our peer-reviewed literature. So these are the following articles that will be referred to throughout the presentation. So first we have our global news article, which is Alberta Polio Survivors Fear Horrifying Virus Can Return by Quinn Oler. Then we have our first supporting article, which is Progress Toward Poliomyelitis Eradication Worldwide January 2021 to March 2023 by Scarlett E. Lee and a whole bunch of other authors. And finally, we have our second article, which is Do Polio and Smallpox Present a Threat? What Nurses Know Can Help Them Prepare by Lisa Drees.
The nursing philosophy that we choose to examine those articles is social justice. It is an approach to focus on fairness, equality, and human rights despite where people came from or their situation. So the first article, Alberta Polio Survivor, Fear Horrifying Virus Could Return, reflects social justice by showing how declining vaccination rate threatens the community health and safety. It illustrates this through the voice of polio survivor who lived through the disease before the vaccine were available. Their story helped people understand the real impact of polio and why vaccines are vital for preventing future outbreaks. Moreover, the article also warned about the misinformation about the vaccine, which can create fear and cause people to hesitate. By sharing these experiences, it promotes understanding, fairness, and community protection, which is a key value within the social justice approach. Second article, Progress Toward Poliomyelitis Eradication Worldwide, highlight the global effort to eliminate polio. It explained that while most countries have controlled the disease, Pakistan and Afghanistan continue to face challenges because of poverty, conflict, and limited access to healthcare. It also noted that vaccine-derived polio virus has been detected in countries that were once considered polio-free, including Canada, showing that no nation is fully protected until polio is eradicated everywhere. This connects to social justice by emphasizing global fairness and cooperation, reminding us that every child deserves equal protection from a preventable disease regardless of where they came from. The third article, Do Polio and Smallpox Present a Threat? What nurses can do to help them prepare, focuses on the importance of education and preparedness in preventing a disease. It explained that while these infections are rare today, they could eventually return if people lose trust in vaccine or don't have access to reliable health information. So by emphasizing the need for knowledge and awareness, the article reflects the social justice philosophy, showing how equal access to information helps the community stay safe. It also serves as a reminder that protecting the public health depends on fairness, inclusion, and a shared responsibility.
This news article creates a strong emotional impact through past marriage story and furnace trauma. It emphasizes the voice for those vulnerable groups. This humanizes the issue and makes the threat of polio feel real rather than theoretical. It delivers a clear and strong message and provides scientific way to protect those children, especially under 5 years old, like get vaccinations on time to prevent those suffering. However, from the news article said, the estimated polio vaccine coverage by 2 years of age dropped in past decades, about 85% in 2021 compared to 93% in 2017. His limited discussion by lacking of the reasons behind vaccination hesitation. Why people hesitate about get vaccination? Is there any lack of spread of education? Also, it's oversimplified solution by ignoring the real-world implementation challenges for those areas like Pakistan and Afghanistan. However, from CDC reports, it highlights social political barriers behind, such as security compromised districts, substantial movements of subpopulation at high risk. So that's the reason hundreds of thousands of people are unvaccinated.
Now we're going to be looking at voices that could be potentially be missing in this news article. So the first voice we realized that was missing is scientific knowledge. So the global news article doesn't explain how the polio virus spreads. So polio virus can basically be spread through water, which is briefly talked about in the article. As it says, polio is mainly spread from person to person, often through contaminated water or contact with fecal matter. The report basically can emphasize on this by saying environmental surveillance, testing sewage samples helps scientists detect polio virus early and how it spreads in communities. So basically, by knowing the importance of environmental surveillance would be good for readers, as it puts an importance on monitoring contaminated areas like water in order to detect potential polio outbreaks in Canada and globally. And then we have our expert voices. So the article does shine a bit of light on the World Health Organization and their contributions to preventing polio, which was the 1988 eradication. It doesn't include like their expert perspectives of like who or PAC officials who could better explain why things are being put into place to prevent polio outbreaks. So the CDC report basically emphasizes that polio can still resurface in places where it has been previously eliminated if the vaccination rates drops. And it also highlights the need to continue mass immunization and close surveillance to fully stop the global threat of perilytic polio in children. So by being able to hear what public agencies have to say about how to fully stop the global threat of polio, it shows that these agencies have done their research and are you finding the most effective ways, which is through vaccines, in order to protect other people and yourself if potentially another polio outbreak could happen.
For cultural considerations, the article Progress Toward Poliomyelitis Eradication Worldwide January 2021, March 2023 explains that global cases of wild polio virus have decreased by over 99% since 1988. However, Afghanistan and Pakistan remain the only countries where transmission of the virus has never been interrupted. In 2021, there were only 5 cases of the virus reported in Pakistan and Afghanistan, but since then, cases have rebounded. In 2022, Pakistan reported 20 cases and Afghanistan reported 2. Both nations face security challenges, political instability, and cultural resistance to vaccination. Populations in rural or conflict-affected regions are often marginalized, facing barriers to healthcare and education. In contrast, countries with strong health systems like Canada are culturally privileged because they benefit from stable institutions and reliable medical services. And as we can see from this diagram, between January 2021 and March 2023, wild polio virus type 1 cases in Afghanistan and Pakistan showed a clear overall decline compared to earlier years. Both countries had high case numbers in 2020, but cases dropped sharply in 2021. Pakistan, however, experienced a brief resurgence in 2022, with several new cases reported between April and July before numbers fell again in early 2023. Polio challenges. So as stated in Global News 2025, polio was eradicated in Canada in 1994. And according to Global News, Alberta polio survivors fear a horrifying comeback as coverage for young children drops from 93% in 2017 to 85% in 2021. So how can we improve cultural sensitivity and inclusion? Health organizations should work closely with religious and community leaders to build trust, employ and empower female health workers in conservative regions, coordinate across borders to reach mobile populations, and in wealthier countries, combat misinformation and rebuild public trust in vaccines and science.
The lived experience of the polio survivors remind nurses why patient education and continued vigilance are crucial. So what are the possible nursing implications? According to JACE 2023, the nursing implications are: first is staying informed about emerging and re-emerging diseases. Nurses need to maintain knowledge about the symptoms, signs, and modes of transmissions of polio. Some of the signs and symptoms include fatigue, fever, muscle weakness, extreme sensitivity to touch, paralysis, nausea, sore throat, and many more. Next is maintaining infection and prevention control skills. It is important to know isolation procedures, PPE use, and outbreak containment approach. Nurses should be ready to respond when a case comes up. And next, we have promoting vaccination and public education. It is critical that nurses educate patients and communities about vaccine safety and effectiveness. Addressing vaccine hesitancy and misinformation is a recurring implication. Next, we have ethical responsibility and advocacy. Nurses have a professional and ethical duty to protect public health by staying up to date on immunizations and educating others. And lastly, we have supporting public health surveillance efforts. Nurses play a role in tracking immunization gaps, unusual symptoms, and alerting public health authorities when indicated.